Okay, hi everyone. Obviously, thank you for giving us the opportunity, Echo and Open Reality, and Sam, appreciate the invitation. I was in kind of two minds as to whether to kind of accept the invitation, because I think when you gave it us, I was leaving NHS Digital and starting with a new organisation, and this event wasn't happening until November, but really pleased that being able to come today and have the opportunity to talk about the rollout. I'll go to a bit of background of the why the project was commissioned and how we approached it, and some of the benefits that we've already started to see. More than happy to take questions at the end, and obviously I'll be around for the day. What I will say is, having heard the first talk and some of the kind of technical questions, I'm not a technical architect. We had a guy called Richard who was our technical architect, and he was brilliant, and I really wish I'd brought him along today. If there are kind of follow-up questions, I'm more than happy to put you in touch with him. But any kind of questions around the programme and the governance and the feedback that we had from patients and citizens and staff, then please do let me have those. So just a little bit of background, goes back to 2014, so quite a while ago now. The Department of Health published a framework called Personalised Health and Care 2020, and that talked about how we can improve health, transform the quality of care, and help to reduce the cost of health and care by using digital technology and data and information. And it also really focused on how do we empower patients to become more in control about how their health and care is delivered, and access the internet to be able to access different services and change really the relationship that they have with the service. So improving patient experience, but also helping to take pressure off the service by self-care and being much more involved in the management of their own care. We then had Dame Martha Lane Fox, who I'm sure most of you will be aware was the governance internet czar and founder of lastminute.com. She made some recommendations to the Department of Health, and part of that was to say free Wi-Fi should be available across all NHS buildings as a way to recognise Wi-Fi as a public amenity, and to enable patients to access the internet and become much more involved in how their health and care is delivered. So really aligned to the recommendations in Personalised Health and Care 2020. Jeremy Hunt, who before Matt Hancock was the Health Secretary, and he really focused on Wi-Fi being a key enabler in the world, in the NHS becoming a world leader in digital healthcare. So one of the building blocks that was needed to support that. And then we worked on the programme for a few months, looking at what the delivery looked like, so scope in terms of how many organisations would be involved, what would we mean in terms of free Wi-Fi, how we were going to fund that, and what levers and incentives we were going to provide to supply community in the NHS to adopt this. And really the kind of vision and scope is very much aligned to Personalised Health and Care 2020, so much about giving people the opportunities to be better connected to the NHS, really focusing also on health and care professionals, how do we enable them to carry out their roles in a more kind of efficient and effective way, giving them access to information and data and information on patients, which help them to improve how they care and support patients, and that's including giving them access to data when they're with patients, rather than having to kind of go back to a consulting room to look at their desktop PC, for example, and allow an opportunity to enhance patients' experience of the NHS and ultimately improve the clinical outcomes for patients. So we agreed on a scope that we would make sure that free Wi-Fi was available in all GP practices across the country, and that was about 200 clinical commissioning groups representing about 7,500 GP surgeries, covering about 60 million patients. And also we'd cover all secondary care trusts, NHS trusts in England, so across mental health, community and acute. It's quite a busy slide, and hopefully these can be made available afterwards, but it takes us through the roadmap that we had from 2016 to the end of 2018. What we were really careful to do was to kind of do this in a phased way and to actually kind of roll out and take on board the lessons learned as we were moving along and adjust our approach, rather than just saying the approach that we agree on day one is the thing that we'll do for the next kind of 2 or 3 years. So we started quite steadily. We had about 1,000 GP practices that were involved in the first phase of the rollout. The reason we started in GP practice was down to funding and affordability within NHS England. So the way that the NHS is funded is through revenue and capital funding. We had some revenue funding which GP practices could use to procure service from suppliers. So we agreed on a set number of clinical commission groups and GP practices. And what we said to them was, we're not going to centrally buy your Wi-Fi service. We want you to have the autonomy and control to buy your own services and to work out how you deploy those. We did put in place some targets in terms of when that Wi-Fi needed to be delivered. And also, we were really key, and I guess this is really relevant to you guys, is to set in place the standards that those services needed to meet. So Richard, our technical architect, worked with our teams within NHS Digital and NHS England to work out what were the standards that were needed around things like information governance, information security, usability and accessibility. And that was kind of recognising that there was a real mixed economy out there. So some NHS organisations did provide Wi-Fi for free, some did it at a cost. Some of the services were great, other services were really flaky and actually not a great user experience. So that was really key. And what we did was we worked with those organisations to say they're the standards and they're the standards that you need to meet, but it's up to you which suppliers that you roll out to. So we did some work with those trusts, and we were able to roll out within about a 3-month period. We took on board some lessons learned around things like we introduced a standard Wi-Fi landing page, so the NHS could cascade information about big kind of programs and digital initiatives, and also support other areas of health. So we have things like on the Wi-Fi landing page, links to NHS UK, which is the biggest health website in Europe. Part of that is about making sure patients can look and access that website to help them manage their own health and care. We had links on to things like NHS blood and transplant, for things like organ donation, and also things like new initiatives that the Department of Health were introducing. So, for example, encouraging people to go and visit their pharmacy rather than A&E if that's something that the pharmacist could support. So we tweaked some of the approach. We then moved on to securing the funding for the rest of the primary care estate, and we engaged with all GP practices to make sure that they're aware of what they needed to do and by what time. In parallel, we also worked on the secondary care delivery. I think personally, myself, from having friends, family, myself being in hospital, you get more kind of opportunity to use Wi-Fi in a hospital than maybe you do if you're in 10 minutes in a GP waiting room. So we recognised that a lot of the benefits would come out from the secondary care delivery. And we've already seen that. So not only does it give an opportunity for the service to engage with patients by having access to Wi-Fi, where patients are using their own iPads or iPhones or other companies or devices are available, but it also enables them to get on with life whilst they're receiving care. So book holidays, pay a bill, keep in touch with friends and family. And again, from my experiences of quite difficult kind of respiratory wards, things like that, they're not particularly nice places to be in the main, but giving people the opportunity to have a look at their device and being able to see what's happening back home with friends and family and children, etc. It's a great opportunity for them to kind of get away from the situation sometimes that they're in. And particularly things like paediatric wards, that was really helpful for kids being able to see movies and things like that. So we started quite slowly, I guess, on the secondary care rollout. We looked at about 7% of NHS Trusts, and our focus was really on those that were furthest away from being kind of exemplar in terms of free Wi-Fi availability. So rather than going to those trusts that through a survey that we did, we knew they all already had really good Wi-Fi and it was well received by patients. We started on those trusts that really had either no Wi-Fi or very little. And we managed to roll out pretty quickly across that secondary care first cohort. We then moved on to securing the funding for the rest of the secondary care estate. And progress the primary care delivery. So by the end of quarter two in financial year 18-19, we'd already progressed quite a long way, and really it was about kind of mopping up any of the GP practices or the hospitals that hadn't got Wi-Fi already in place. So we had a commitment by the 31st of March 2019 that we'd meet Jeremy Hunt's commitment to have free Wi-Fi rolled out. I think effectively we had about 97% of trusts that had it available, and it was seen as something that's a real kind of enabler. And I guess when we look at, or I've looked at business cases over the last 13 years working in government, you really look at the return on the investment, and unless for every £1 you spend you get £4 back, for example, that investment's not really going to work for the majority of the time. But what we did with Wi-Fi was we kind of made the case to say this is something that will support other programs. So things like the NHS app that you might be aware of allows you to book a GP appointment or order a repeat prescription or change your organ donation preference. That's now had 1 million hits, and being able to kind of signpost that from the Wi-Fi landing page, being able to promote other systems and services is something that was really seen as a kind of key enabler. So we were fortunate in that we could point to other areas of government like the Department of Culture, Media and Sport and the Ministry of Justice that had put Wi-Fi in buildings, but it had also kind of supported other projects and programs that they were delivering. So we effectively started to kind of close the program from that point, 31st of March 2019. But what we did was we were very, very keen to continue to work with trusts to make sure that they knew that if they had issues in terms of their deliveries, they had somewhere to go to, and we could speak to suppliers where that was appropriate to help support them to get to where they needed to get to. And I'm pretty sure that whilst I left a few months ago, that project's seen as having have delivered. And I think part of our original kind of scope was to say Wi-Fi shouldn't be seen as a nice to have in hospitals, both from a patient perspective and from an NHS staff perspective. We really wanted it to be seen as, you have lights in hospitals, you have running water, you have toilets. These are things that you absolutely need to have, and they're essentials. And I think that's becoming the norm in hospitals now and GP practices as it is on trains and shopping centres and the like. So this is a little bit dated now, so that kind of goes through the delivery status back to the end of February 19, where we had 91% of clinical commissioning groups, which is 93% of practices live and 93% of secondary care trusts. What we were really, really keen to do was to not kind of just give out lots of money to the NHS and just leave them to it. We asked them to report via a portal to show us what stage they were at in the implementation, from having an initial plan to having a local business case signed off and starting a project and then delivering and making sure that they were tracking benefits. So that's still live, and it's on the NHS digital website for people to have a look at, as are the standards around information governance and security and usability and accessibility, if you want to have a look at that. These were some of the kind of early statistics from patient usage, so predominantly around the kind of GP practice side of things. And we found that actually usage, as we expected, was going up month by month. We also did some analysis to look at the where people were going from the landing page. So you can see that pie chart on the bottom right-hand side. A lot of people, 27.4%, were going to the NHS UK website, 33% were going to the Give Blood website, 11% were going to the apps library. And again, that's another thing. So as well as the NHS app, we know that there's lots of paid for and free apps that are out there that are supporting many people with long-term conditions, but also many people who are very, very healthy and still want to be able to use apps to help them support their own care and well-being. And then just moving on to kind of the usage within NHS Trusts, and this was from a similar period, I think from January 2019. The blue was the kind of primary care element of hits. The orange was secondary care, so you can see that we had way more hits across secondary care than across primary care. Some of the benefits, so again, I think kind of link back quite well to the original business case and our scope, so very much around kind of reducing how the cost of health and care services are delivered. So we've seen that organisations have been able to kind of break down barriers by having allied health professionals, for example, being able to go into GP practices and work from there. We've seen the costs of some of the equipment come down because people don't have to have kind of fixed desktops all the time, and they're able to kind of use Wi-Fi to work together more efficiently. And we've been able to see Wi-Fi being used to support things like video conferencing to enable costs to be cut down to avoid people having to travel. And also things like improving the quality of health and care. So we've seen that, for many years, hospitals for many people aren't necessarily a great place to go to because of the risk of picking up hospital-acquired infections or elderly people having a trip on the way into hospital. So Wi-Fi has really been helpful in supporting new models about how care is delivered, so avoiding all that kind of face-to-face time that sometimes is not necessary. Improve patient experience and satisfaction, that's really key from our side to make sure patients can adopt and utilise technologies to support how they interact with the service. So in the same way that you might look at what your balance is on your bank and pay a bill using an app, we've been able to see how Wi-Fi's supported a much greater user experience from patients and also satisfaction. So for example, rather than having to go into a GP practice and wait in a queue to book in, they've been able to go in and use their iPad or phone to check in. And even things like being able to give feedback to the practice. Improved access to information for health and care professionals, so really aligned to make sure that healthcare professionals have the information they need to make informed decisions about patient care remotely, and being able to access things like electronic healthcare records from patients and being able to kind of recommend other apps or other services that patients can access. We're also creating from this a platform for the future, so there's opportunities to build on things like the national landing page, so local organisations can have local landing pages and point to information on their services or maybe initiatives that are happening within the local area, and promotes the opportunity for joined up working. So again, very similar to what I was saying before around allied health professionals being able to come on board, come into a site and connect to their home network at a GP practices. We've been able to see some really good success stories where multidisciplinary teams have been able to kind of get together in a room and all access information and at one go, rather than having to kind of work in separate locations. And then just a couple of kind of quotes around some of the feedback that we had from patients and from people, from staff who are working in the NHS. And these were some of the kind of early ones to say how that supported them. But we've got kind of countless other stories on the NHS digital website from healthcare professionals and from patients. And even really simple things like one of the ones where at Doncaster Royal Infirmary, where they were able to stream the local town Christmas panto to staff within the hospital and to patients. They're really things that I guess can make a real difference, particularly when you're in hospital, when times you're going through a particularly difficult time. But we're really pleased by the progress that was made on that. I think it is supporting other programmes and projects nationally and locally that are out there, and it's something that absolutely was the right thing to do. But that needs to be built on. We need to make sure that the coverage stays strong, and we listen and take on board feedback from patients and staff. I think that's about it.